Good afternoon, and thank you for joining us today. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 885 new cases of COVID-19. This brings our statewide total to 42,050 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Approximately 2,394 of our total cases are in healthcare workers. Approximately 7,037 of our total cases are associated with 441 distinct long-term care living facilities. That includes nursing homes, personal care homes, and all congregate settings. Tragically, we have now had 1,597 deaths among those who have tested positive for COVID-19. And to date, all of our deaths have been in adult patients. As of noon today, hospitals are reporting approximately 2,799 patients are currently hospitalized due to COVID-19. 615 of those hospitalized require the use of a ventilator or a breathing machine. Across our healthcare system, approximately 47% of hospital beds, 40% of our intensive care unit beds, and nearly 70% of our ventilators are still available. Today, we released guidance to provide a process for hospitals and ambulatory surgical facilities to resume elective surgeries, procedures, and admissions. This guidance is in line with the recommendations of the American Hospital Association, the American College of Surgeons, the American Society of Anesthesiologists, and the Association of Perioperative RNs. In addition, it's in line with guidance of the Children's Hospital Association of the United States. We know that many Pennsylvanians have had to delay important elective procedures and operations, but it was necessary to ensure that our healthcare system had enough capacity in case it became overwhelmed with patients with COVID-19. Using this guidance, these procedures and admissions can move forward, as long as doing so won't jeopardize the safety of patients and staff, or hamper a hospital or a surgical center's ability to respond to a COVID-19 emergency in that area. In order to start elective procedures, facilities should ensure that there is enough personal protective equipment to be prepared for a surge in COVID-19 cases. Facilities also have to be able to safely treat patients without resorting to crisis standards of care, where they would have to prioritize care during a surge. And facilities have to have enough trained and educated staff to not only handle the procedures themselves, but a potential surge in hospital patients. We've been working very closely with our hospital partners to safely ensure that Pennsylvanians who need treatment not related to COVID-19 can get it. This guidance puts forth ways for hospitals and ambulatory surgical facilities to do that while making sure that we stay prepared for any possible resurgence of COVID-19 in those areas. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. Use hand sanitizer if soap and water are not available. Cover any coughs and sneezes with your elbow, not with your hands. Don't touch your face, especially after touching surfaces, and clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come into contact with others. These everyday prevention measures can help slow the spread of the dangerous virus, COVID-19, and give hope to our families and our communities that we will recover together. If you have questions about your health, please contact your health care provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. From the Citizen's Voice, of the COVID-19 tests that have been given at the Mohegan Sun Arena site in Wilkes-Barre Township, how many have come back positive?
So approximately 5 to 7% of those tests have come back positive. It's a relatively low percentage, but it brings out a point. We want more people to come to that testing site. We have this mass testing site available. You can either register online or call now 1-877-PA-HEALTH, and you can register to get a test done. It's a drive-through site. You can get to it easily off the highway and then be routed right back on the highway. And so I would encourage people to come and get tested. We are testing really anybody now that has symptoms consistent with COVID-19. In the past, we have prioritized healthcare workers, seniors, those in long-term care living facilities, etc. But really, we have the ability now to test more people, and we'd like more people to come to that site.
From WGAL, we have a question about target reopening metric. Is the average for that metric a county or the average of the region? So when determining what region will reopen, will the state average all of the county numbers?
So it'll be in the counties, and the counties form a region. But I don't want to emphasize this metric too much. How to calculate the metric is on our website, and we'll be looking at that in those counties, and we'll be looking at the regions. Those are our healthcare regions for the Pennsylvania Department of Health. But as the governor said today in his press briefing, we're not going to be specifically held to any particular schema. That was there so that people would understand what the regions look like. So we're going to be looking at that metric. We're going to be looking at many other things. We're going to be looking at the ability to do testing in an area, and we're looking to expand testing. We're going to be looking at our ability to do case investigations and contact tracings. We're expanding our ability to do that. We want to make sure that the hospitals and health systems in those areas can take care of any outbreak of COVID-19. And then, of course, we'll be looking at the modeling done by Carnegie Mellon University. So many things will be under investigation this week as we determine which areas, which counties and regions can go from red to yellow.
From WGAL, what is enough testing and enough contact tracing? Are there specific numbers or metrics to determine what is enough and to move from red to yellow to green?
So that's a good question. I don't have a specific number. We're going to be looking globally at our ability to do testing. We're going to look to expand testing through hospitals, health systems, and other medical providers in that area. We have had discussions with Rite Aid about testing in their facilities. We might look at some other facilities to do testing. We've discussed the possibility of a mass testing site or maybe mobile vans, and we're going to have more granular detail about that later this week. But we want to be able to expand that testing as well as the contact tracing. We have some plans finalized about that. We're going to be looking at working with our fantastic community health nurses as lead in those counties. We'll look with the hospitals and health systems to be helpful. We're going to have some volunteers and hire some extra people to do those case investigations and the contact tracing. I've called those specialists our disease detectives. So we need to have those in place as well, and then we're going to be ready to go forward by May 8th.
From WNEP, we've heard from several counties in our viewing area where officials plan formal requests to be moved to a different region for reopening purposes. How would the state handle those requests?
Well, we'd be glad to take any requests and discuss all of those different options. But again, we're not going to be specifically held to the regions on a map. We're going to be making some informed choices about regions and the counties.
From WGAL, I'm wondering if the Secretary or Governor can say how many business complaint forms have been filed since its launch. And the response to criticism from some state lawmakers is that it's too much of government Big Brother imposing itself and punishing businesses.
Well, so I don't have a specific number of the number of complaints. I actually believe that a lot of the information that we have received has been rather positive in terms of our mitigation efforts. But we at no time want to be Big Brother. And that reference, we really have been working on, during the last 6-7 weeks, on mitigation of the spread of COVID-19. As we have seen with the numbers today, this is a very dangerous virus. We have, tens of thousands of residents that have contracted COVID-19. We have over almost 1,600 individuals that have passed away from COVID-19. You can see the impact it's had on other countries, other states, New York City and New Jersey, etc. And so the way to prevent the spread was the mitigation techniques, the closure of schools, the closure of non-essential businesses, and the stay-at-home orders. But now, starting on May 8th, we'll be ready to start the reopening, going from red to yellow of specific regions in Pennsylvania.
From WKOK, as part of the state's, as our part of the state heads into yellow light next week, how are our hospitals factored into this? And please detail what roles hospitals play.
Well, hospitals will play a couple of different roles. First, they have to have the ability to take care of patients with COVID-19 and respond to an outbreak if we find that. In addition, we are going to be working with some hospital personnel on the case investigations and the contact tracing. So very important roles for our hospitals and health systems as this process proceeds.
From WNEP, the temporary hospital at East Stroudsburg University has been open for nearly 2 weeks. So far, it has not treated any patients. How long does the state plan to keep it open?
I don't have a specific information about that, but we are so pleased that the hospitals in the Northeast have been able to take care of the numbers of patients that have come, and that we have not had to use this alternative care site. The alternative care site in Philadelphia has seen a number of patients, but not that many. And so really what it shows is that the mitigation efforts under the governor's leadership have been successful. We have been able to flatten that curve so that to date the surge has not overwhelmed any of our hospitals and healthcare systems, and that's a success. Exactly how long we'll keep it open, I can't give you a date.
From WESA, on Saturday, the state said that it would not be using the average numbers of new COVID-19 cases to determine when an area could be considered for reopening. This was 3 days after the process to reopen Pennsylvania plan came out, saying the metric would use an average. What happened between Wednesday and Saturday to make the administration decide not to use an average daily case count, but a total case count?
Well, so we have worked to refine that metric, but again, I really don't want to concentrate on that metric. It is something that we put down so that we would have some quantitative data to look at, but this will be a qualitative decision with some subjectivity as well about how we're going to have counties and regions go from red to yellow.
Also from WESA, will the administration be releasing a map or a list of each county or region with its 14-day new case count? If not, is there another way for the public to access the historical information for daily new case counts within the past 14 days?
Well, you can go and, so for the regions that we open, we haven't made that official decision, but that seems reasonable for those regions and areas that are going from red to yellow. There you go. But I think that, we're not going to give a statewide, county-specific map about that. People can actually calculate it off the data on our website.
From 6ABC, under the governor's plan, we're looking at regions as a whole to reopen. Should we be talking about cases in areas that are not part of the general population, like nursing homes and prisons? should we be taking out the cases in areas that are not part of the general population, like nursing homes and prisons? Do you believe by doing so we would meet the numbers quicker here in the Southeast region? And what are your overall thoughts on why this may or may not work?
So we do not want to take out the cases involved with long-term care living facilities or correctional institutions, etc. That is part of those counties. And all of those facilities have staff that often live in those areas or nearby. And so that, is involved in terms of the burden of illness of COVID-19. So I know it'll be challenging in the Southeast. What I said on Saturday is the Southeast will be able to go eventually from red to yellow, etc. But it's clearly not going to be at this time, because that's where we're seeing most of the cases. But I've said before, I'm a positive and optimistic person, and we'll get there. I know that things could go quicker, but we want to be accurate and we want to be safe, and that's better than just being quick.
From WESA, if the panel unanimously decides that all but one counties in a region are safe to reopen, will those counties have to wait until the one county becomes eligible to reopen as well?
I think that's unlikely. So we're going to be looking at counties and at regions. I think this will be clear as we make our decisions later in the week in terms of how we've calculated it. We'll be looking at the metric, but we're looking at many other factors, as I've pointed out, in terms of making those decisions.
From the Scranton Times-Tribune, is part of the strategy behind the 50 case per 100,000 threshold to reduce the amount of contact tracing and testing you'll have to do once you start opening up a region? In other words, if you don't have the resources to do widespread contact tracing, but if you're down to a fewer cases in the region, it's easier to do contact tracing and test.
Overall, we wanted a metric that would help us compare different counties and different regions. So it was just picked and calculated so that we would have some quantitative data to look at.
From WESB, Dr. Levine, could you please address any concerns you have about reopening northern counties that border the southern tier of New York, which has many more cases of COVID-19?
Well, so, we have concerns as we start to reopen it all. And we're going to be working really, really hard to prevent any potential outbreaks in those areas. People can, in the United States, go between different states and in Pennsylvania between different counties. But we're going to be watching really carefully for any potential outbreaks in any county that goes from red to yellow.
From 6ABC, New York is taking the approach to reopen looking at data on declines in hospitalization rates. Is Pennsylvania taking that into account, and how does that factor in?
Well, we're going to be looking at all of our data, and so I think that's a really interesting point of data that we'd be pleased to look at as well. But many different factors will go into that decision whether a county goes from red to yellow.
From WESA, you've said the quantitative case count benchmark you've set is just one of several factors that will be considered when it comes to reopening. Do you have plans to release a full list of these factors?
I think we've already released on our website in terms of the path forward what the different factors would be, but I've outlined them already today.
PBS 39. The National Guard is stepping in to help with staffing at Northampton County's nursing home Graysdale, which has experienced more than 700 employee call-outs this month alone over coronavirus fears. Why do you think there's such a large number, and is that a problem at other private or public nursing homes statewide?
Well, what I've said before is that our biggest risk factor and our most vulnerable population are seniors and other patients in congregate living settings, and that includes long-term care living settings such as nursing homes and personal care homes. And certainly the patients in those homes are at risk of getting COVID-19. Many are seniors with other comorbidities, and it puts them at severe risk, as well as the very brave and courageous staff that are working in those facilities. And so, yes, at times we have had such challenges in those settings that the National Guard medical personnel have gone in to to help. And so it is a challenge. And we have our great disease detectives doing epidemiology and infectious control consults in those settings. We're going over the proper use of personal protective equipment, about cohorting patients, cohorting staff in certain areas to try to avoid spread of COVID-19. And then we've contracted with the company ECRI to do further infection disease consultations. And then, if necessary, the National Guard has stepped in to try to help as well.
From WBRE, we're getting a lot of questions about pet groomers reopening. Some are asking when these businesses will reopen, saying most of these dogs and cats are now going 6 weeks without haircuts and baths. Dogs are getting matted, which is painful and causes skin irritations under those mats. Their faces are overgrown with hair that are now in their eyes and can cause eye problems. Their nails are getting long and could curl around to the pad and cause an infection.
So, with businesses like that, we're going to be following the red, yellow, green schema.
From WQKY, can you clarify which type of businesses will be permitted to open in the yellow phase? For instance, golf courses, beauticians, barbers, state parks. All manufacturers did not meet the DCED parameters as essential.
So, yes, many businesses will be able to open, but some businesses will not. So we're not going to be opening restaurants outside of curbside delivery. We're not going to be opening bars. We're not going to be opening sort of large venues like movie theaters or any type of concerts. But many other businesses, and you mentioned the pet groomers, et cetera, will be able to open. And so we're looking forward to that step, going from red to yellow, and then we'll be implementing our measures to make sure that there are no outbreaks. And I think that people in those areas of Pennsylvania are going to be very pleased to be able to be some lifting of the stay-at-home orders. But we need to remain vigilant. COVID-19 is not gone from Pennsylvania. We're going to need to be really careful about the spread. So we still want people to wear masks. We still want people to practice as much social distancing as they can. We want people to wash their hands and go through the other measures that we talk about in my daily reminders. And we have to still be careful about any potential spread of COVID-19.
From the Philadelphia Inquirer, according to the recent reporting by the Philadelphia Inquirer and others, relatives of nursing home residents can't always get accurate information about their loved one's health status or about outbreaks at the facilities. Given that, do you plan to name specific nursing homes with outbreaks as other states have?
We're considering that. We have to take into account many different factors in terms of patient privacy and confidentiality and the functioning of the facility versus the people who want to know. Really, it's the responsibility of the facilities to be notifying the loved ones of patients in those facilities, and that's where the primary responsibility lies. But we'll be considering other measures to make sure that families get the information that they need.
Also, the Inquirer asks, do you have any updates or leads regarding coronavirus testing chemicals and supplies that are needed to reopen but in short supply in the state?
Well, we are doing somewhat better in terms of our supply of the chemicals and reagents to do testing. That includes the ability to do more testing at our lab in Exton. In fact, our lab is doing all of the testing for the site at the Mohegan Sun Arena parking lot mass testing site. In addition, we know that hospitals and health systems will have the ability to do more testing. In fact, one of the things we're asking hospitals to do in ambulatory surgical facilities is if they schedule someone for the elective procedures we talked about, to test them for COVID-19 beforehand. And all of that data will be really, really useful for us. So I think our hospitals, our health systems, the commercial laboratories, our laboratory are doing better in terms of the supplies. What we really want is a consistent supply chain, so we know that that will continue. We had discussions with the federal government yesterday about that, as well as working with the manufacturers of the testing supplies themselves to try to make sure that that is a consistent, reliable supply chain so we can continue to expand testing.
From WESA, the process to reopen Pennsylvania plan says businesses must follow CDC and DOH guidance for social distancing and cleaning. Is the DOH guidance publicly available online? And if so, where and what is the page or document called? Or is it being provided directly to businesses?
It's actually on our website. I believe it's called Guidances for Businesses.
From 6ABC, Philadelphia is nearly 7.5 times the benchmark you set forth to move to the yellow phase. That doesn't give much hope for Philadelphia to reopen soon. When do you anticipate Philadelphia reopening? In a month, 3 months, or 6 months? People deserve to know some estimate based on the data you have.
Well, so I don't have an estimate, but again, I think hope is really important, and I feel very confident that in the future that Philadelphia will be able to go from red to yellow. But as Dr. Fauci says, the virus determines the timeline. We don't determine the timeline. We've discussed this extensively with Dr. Farley, the Health Commissioner of Philadelphia, who I'm speaking with this afternoon. We don't know when Philadelphia will be able to go to yellow. We don't know when the collar counties will, but it's very important to have hope for the future, and we'll get there.
From WQKY, Governor Wolf issued a tweet regarding the class of 2020. Is he saying that no in-person graduations are permitted in the state?
I'm not specifically familiar with that tweet, but we know that the school has been canceled for the rest of the school year, and we're not going to allow large gatherings, even in yellow zones. So I think that that's a fair assumption, is that graduations will have to be remote. They will not be, large groups of people will not be able to congregate for those ceremonies. It's a real shame, but this is a global pandemic, and we have to take precautions.
From WESA, the department is no longer counting probable deaths in its totals. Is it still counting probable cases? And if so, what happens when someone whose case is probable dies before a test can be performed?
So we are counting probable cases. It's approximately 1% of our total, so it's not a very large number. If that patient who is a probable case dies, we are including that case in our death total. But we're not including the separate category of probable deaths, and we have no intent to do that in the near future.
From WPXI, what is the significance of 2 or more consecutive days without reported COVID deaths? Does that mean we're in better shape in getting closer to reopening?
Well, so we need to look at trends over time. Each day's results we take very seriously, but it is trends over time that we're looking at. We have many different statistical ways to be looking at trends of cases over time, trends of hospitalizations over time, trends of deaths over time. So consistent decreases in cases and hospitalizations and in deaths is a very good sign, but we need to continue to watch the daily data.
Also from WPXI, there have been reported deaths in the Allegheny County nursing home Kane Glen Hazel location. Are you concerned about that number, and is there anything different being done to help slow or stop the spread of deaths in nursing homes?
Well, I'm not specifically familiar with that facility, but again, I speak with Dr. Bogan today, and we can discuss it. She's the health commissioner for Allegheny County. But yes, we are very concerned about the care of individuals and the number of cases in long-term care living facilities. I outlined previously that we have many different measures to be able to address that, but Pennsylvania, as really every other state and other countries, have had significant challenges with those facilities and the spread of COVID-19.
From WLVR News, how much does the discovery that race data has only been reported in a third of cases call into question all previously reported lab data about other health issues in the state, and what is being done to enforce this data as properly reported in the future?
Well, so it has been a challenge to get race data in terms of our reporting. That became very evident when we were reporting the amount of lead poisoning in children, and we have made some specific efforts to make sure that we get that data for lead toxicity, and we're making those specific efforts in terms of COVID-19. In the future, when we have the opportunity, we are actually in the process of updating our system from NEDS, which requires manual input, to a more computerized system. I'm hoping that that will actually make it easier for us to be able to get that data. We were kind of in the middle of that, had to put it on hold when we had the global pandemic of COVID-19. So when we have the opportunity to go back to that, I'm hoping that that will improve our ability to get that very important data.
From the Tribune Democrat, Cambria County Commissioners have asked the Governor's Office to consider the county separately from the Southwest region. Part of the county's request notes the stay-at-home order was phased in on a county-by-county basis, advocating for the same procedure for reopening. Has the Governor or Health Department considered changing the region-wide requirements for easing mitigation requirements?
Well, it's going to be taking into consideration the counties and the regions. It's not just going to be county. We'd be pleased to consider their request as we're considering all of those requests.
And our last question today is from 6ABC. Many say the requirement threshold is too restrictive to reopen. Is there any talks to adjust the criteria?
Well, as I've been saying today and in the past, this is just one piece of the puzzle. There are many other pieces of the puzzle that we'll be considering.
Thank you, Secretary. That concludes our briefing for today. For the reporters' questions, or we were not able to get to, we will respond within 24 hours. Our next briefing will be tomorrow. Thank you.